afternoon. Well, my name is Andrea and I am the VP of D&A Brand Management. Today we're going to bring awareness to the Miami community about post-op care. So I have here right now Cindy Fonseca next to me, who I'm going to go ahead and ask her some questions because she did go through the plastic surgery experience. So I want to go ahead and ask her a few questions to see how her whole routine and experience was during that process. So Cindy, thank you. Thank you so much for being here. So Cindy, tell me a little bit more about what led you to having the cosmetic surgery.
Well, thank you for having me on the interview. So the reason behind my cosmetic surgery experience was because I pretty much just wanted to feel confident about, being, whether it's in a bathing suit or a pair of jeans or just being outside in my own pool in a bathing suit. So I tried every diet that I could under the sun, and it was never really getting me to the results that I wanted. So ultimately, the most drastic way to go ahead and get to where you want it to be is cosmetic surgery, which is what ultimately led me to that experience.
Doing the surgery. Okay, great. And when you did the cosmetic surgery, what homework did you do prior to doing the cosmetic surgery?
Well, definitely in trying to research about, first of all, the procedures that were offered, what I wanted to do, what I felt comfortable enough with doing. I never thought of myself as somebody that would go ahead and have plastic surgery. So for me, it was a very back and forth experience in getting to that point. I even canceled my appointment the first time, and then, eventually I went ahead and, after researching my doctor for, so many months, I finally decided to go through with it. I decided on the procedure I wanted to go ahead and get done. And I mean, it was basically the doctor and I was able to find the right doctor after researching, made sure he was board certified and everything that he needed to be in order for me to feel comfortable.
Okay, great. And how did you know that you had to have post-op care after your surgery?
I actually didn't. I honestly thought that it was like if you would go into an emergency room or an operating room after a regular medical surgery, come home, recover, and then that was the end of it. I actually found out about post-op care once I was referred to the nurse that took care of me, but I had no idea. I didn't know that, you needed to go ahead and have somebody watching you. I didn't know that it was gonna take everything that it took after I came home. And I'm glad that I did have somebody to be here with me because I really honestly had no idea about post-op care.
Okay. So the post-op care, did it come included in your package?
Yes, it did actually, which to me, even then when it was included in the package, I didn't think of it as a nurse coming in to be with me the way that I would be, let's say, if I go to an emergency room. I thought it was going to be somebody that was going to come in, sit next to me and have to go ahead and dial 911 in the case that I stopped breathing or whatever the case would have been. But no, it wasn't until I got the first phone call of my nurse, when my nurse introduced herself to tell me everything that I needed to have before going into surgery and what I was going to need after surgery. And then during the actual care, after I went ahead and, got home, she would, taking my vitals, taking care of me like if a normal nurse would. And that was, very comforting.
Awesome. And what was your experience when it came to having that post-op care? You're stating that she basically did everything like a regular nurse, but exactly what did that nurse do for the post-op care?
Well, she did go ahead and pick me up from the surgery. Okay. So that in itself made me feel a lot more comfortable because this was somebody that knew how to get me home to make sure that I was okay. I also, when she was here, it felt like I was being taken care of by somebody who knew what they were doing. I knew that my husband would have been overwhelmed if he would have had to take care of, me all by himself. So having somebody here, number one, that was able to comfort me, somebody that was able to comfort my husband and let him know, hey, listen, this is normal. You feel this way, it's totally okay. You're gonna feel better tomorrow. And that was definitely something that my nurse did for me. She kept telling me, don't worry, I know that you don't feel well right now. I don't do well with anesthesia. So she kind of reassured me, hey, you're gonna be fine. Tomorrow you're gonna feel much better. And it was just having somebody there that was able to really honestly take care of me the way that I needed to be taken care of.
That's great. That's awesome. And I'm sure you felt very comforting and you felt safe as well,
Yes,
right?
definitely.
Okay. What would be your advice to women and men that decide that they do want to have plastic surgery done?
Definitely go ahead and make sure that whoever you go with is board certified. That's probably one of the most important things. Definitely make sure that you have a nurse that's taking care of you, and it should be somebody who knows what they're doing. I've heard about different places that people go to, and unfortunately sometimes the news is not good news. So I would definitely have somebody that knows what they're doing, somebody that is able to go ahead and provide that service that you need so that you can get the best out of, the experience that you just had. So I think that's probably one of the most important things.
Awesome, awesome. Well, thank you so much, Cindy, for all the tips that you gave us and the information. I feel like this is honestly going to assist other people in the future to be more knowledgeable and to really do the research as to when selecting a doctor and making sure that they obtain that post-op care that they need. For them to have a successful surgery. So other than that, thank you. It was a pleasure speaking with you, and thank you to everyone else that was listening. Hopefully this is something that can be useful to you all, and if you have any questions, just let us know and we'll be able to answer those questions for you. Hi, well, welcome back. I have Michelle here from Healing Corner. Again, my name is Andrea. I'm the VP of D&A Brand Management. Back to where we were speaking about the awareness when it comes to post-op care, I asked Michelle to be able to speak on regards to the matter. So Michelle, thank you so much again for being here and allowing to bring that awareness to the Miami and to anyone in the United States. So I'm going to ask you just a few questions. Michelle, tell me a little bit more about you and what you do.
So my company is called Healing Corner. I am a private care nurse in Miami, so I do post-op care as a nurse. And my services entail like making sure that the patient is stable after a cosmetic surgery or any surgery, but I do specialize in the plastics. And so basically I start, guiding my patients from the moment they contact me all through like their recovery before and after surgery as to what they'll need to prepare and like what to look out for post-operatively, and just give them a lot of guidance as well. And then during the hours that they are after surgery, I make sure that I'm checking their blood pressure, their vital signs, and making sure that they are stable and need any assistance aside from the nursing part. That's basically what Healing Corner does for the post-op care services.
Awesome, awesome. And Michelle, what type of recommendations would you give the public to look out for when considering plastic surgery?
When somebody contacts me and is still on the fence whether they want to do surgery and they don't have a doctor yet, I always recommend, or even like on my social media, I like to spread awareness. Do your research. Make sure that you're looking into your surgeon. That's where it starts in the OR. Like what type of certifications, what is their level of experience? Are they board certified in anything? Because there's different types of board certifications. So if you're a plastic surgeon, you would want a surgeon that is board certified in plastic surgery. Sometimes other surgeons have double certifications, they're different specialties, but mostly like look at your reviews, talk to your doctor, look at many options, see who you feel most comfortable with.
Okay, great. And what types of licenses should the audience or the public look out for when providing with the right post-op care?
So post-op care, there's different types of licenses that providers have to provide these services. Okay. They are also public record. So if you go on the health department of your state and you look for somebody that tells you they're a registered nurse under their name, you will find their license, whether it's active, what type of nurse are they, registered or licensed LPN. There's also CNAs, certified nursing assistants. Or if you have a massage therapist that's coming in to your home or you're going to a place to do this, because post-op care is not just nursing, it also entails like, the massage therapy. Look up their licenses and make sure that they're active and not restricted. And also, what kind of experience do these providers have? How many years have they been doing it? What other specialties, have they been in? Certifications, because you can have a license and then you can also have special certifications. So that's definitely something I recommend that people look and ask for, you know, do your due diligence in that sense.
Of course, of course. And thank you so much for that, because a lot of people don't really know what to expect after surgery. And how did you meet Cindy through the process?
Cindy contacted me. Actually, she was assigned through a surgeon that he provides post-op care for nursing for some of his patients. And so when I was assigned to her, I reached out, introduced myself, asked her where she was in her process of post-op care. She didn't know really like what to expect. She really thought that surgery, you know, she was going to be home and be okay and her husband was going to care for her. So she was very grateful to have that service provided. And so I went ahead and made sure that she had everything once, we contacted each other.
Awesome, awesome. And so what are your steps that you take with your clients when they reach out to you for your service?
So I always like to be very transparent with my clients as to who I am. I always introduce myself. You know, I am also certified by the Administration of Healthcare, ACA, to provide services under a home health exemption, agency exemption. And so I like to tell them that, you know, so that they know. Sometimes they don't ask, but I'm always very transparent as to what I do, what my background is. And, you know, I ask them who's their surgeon, when is their procedure. I make sure I have availability to care for them. And then we go through a process of just getting to know one another and making sure that they know what they're going to need specifically, because there's a lot of different things that go into post-op care.
That's awesome. And so once you finish a service with them, do you follow up with them or?
So during our service, you know, I do a lot of teaching. So there is family members if they are with them, or even over the phone, a family member that's going to be caring for them. Sometimes people come from out of town. You know, Miami is a big community with plastic surgery.
Yes.
I make sure that they know an adult is going to be there, because it's not just the 24 hours that I'm with them or the week that I'm with them. It does take sometimes up to 6 weeks to fully recover. So I teach a lot of the stuff that needs to be done, look out for, what are signs and symptoms of complications, you know, how are you feeling, is this normal? And yeah, I do follow-up calls, you know, within our time that pertain to like the service, to make sure that everything is going well.
Awesome, awesome. And so how do you minimize risk when you're providing the type of care for your customers, patients?
So when I encounter a patient, or, you know, they contact me, I always like to know first who is their surgeon. Since I said earlier, it does start in the OR. If I know that a surgeon cares about their patients, that they have good bedside manner, that they are certified, board certified, and they have the experience that they are, you know, with these surgeries, I like to accept patients that I feel like are already set up for a good recovery from their surgeon, you know. And then I make sure that everything is, an emergency plan is in place. I explain to my patients, like, if these things happen, I actually have a guide in a welcome packet where they know exactly what to expect in case an emergency. I have a plan. If I have to call 911, like, my priority is always their safety, and they know that. And so I always like to refer to a plan and make sure that the surgeons are also on board with the type of care that I like to provide.
Awesome, awesome. Well, I think those are great tips and great advice, because not a lot of people are aware about having the post-op care that is needed when you're having surgery or getting surgery. I didn't know that you had to get post-op care. So this is something that I feel that it's great for everyone to know. What have you seen that is really out there in the Miami community that has came out as far as illegal, you know, homes? And what do you recommend for your audience to look out when going for the right place?
Yeah. So going back to that, this information is public. You can always contact, you know, your healthcare department. Make sure that these licenses are accurate. Recovery homes, if not having the correct licensure, are illegal. They do have to go through an extensive process to become like assisted living facilities in order to provide care with the proper staff on home. You know, sadly, we have seen cases in Miami, women that come from out of town, they don't know these type of things, so they go to a home trusting somebody, you know, in their hands, and they're not providing a licensed personnel to care for these women. And you know, sometimes complications arise a lot of times in surgery, and if you don't act quick and you don't know what to look out for, sadly women have, you know, it's been on the news that they've lost their lives, and something that can be prevented, you know. So those are very important things to look out for when you're choosing your post-op care providers, just to make sure how legit everything is.
Of course, of course. Well, thank you so much, Michelle. I do appreciate. No problem. I want to make sure that we're bringing this awareness to everyone in the community, because there's been a lot of cases, unfortunately, where people have passed away or they've marked their lives for forever because of that. They've had bad results. So I want to thank you so much for allowing me to interview you and being able to be a part of this awareness that we're trying to bring to the community. Again, any questions, you can always reach out to Michelle. She'll be able to assist you. She does have her business, which is the Healing Corner. If you have any questions whatsoever, either reach out to us at D&A Brand Mgt or at Healing Corner. At Healing Corner, and she'll be able to assist.
Yeah, I mean, it's a great thing. I feel like, you know, that you gave me also the opportunity, because people don't know you can hire a private nurse to bring to your home or your place of where you're recovering, you know.
Of course, I didn't know that.
Yeah, you hear surgery and these recovery homes, or you think that you have to stay in the hospital, you know, so you do get discharged after 1 hour in the post-op care recovery unit inside the surgical center. So it's nice to just spread the awareness that there is an option to have somebody care for you, you know, during the most important times. So thank you.
Of course, of course. No problem, no problem. Again, thank you so much to everyone listening and tuning in. And we hope to see you all again soon.
Do.